Hello and welcome to Health Professional Radio. Thank you so much for joining us today. Our guest in studio today is Dr. Bruce Roseman, New York-based physician and author of the Addictocarb Diet. He's here with us today because, he doesn't believe that weight gain is related to portion control, and he's here to talk about why his diet, the Addictocarb Diet, works as opposed to, any other diet. He's passionate about it. How are you doing today, Dr. Roseman?
I'm doing terrific. Thank you. Thank you for having me.
Thanks for returning to talk with us. In other segments, when you were here, we talked about the Addictocarb Diet and the neuroscience, how it's just as addictive, some of these carbs, as certain hard drugs. For some of our listeners who may have not have heard these other segments, could you talk about some of these carbs, how they are as addictive as maybe heroin or cocaine?
Well, pure and simple, if you do MRI scans on patients who are on heroin, and you compare it to MRI scans of patients who are eating these addictive substances, they look exactly the same. Not similar, they look exactly the same. It's clear that it stimulates the same area of the brain. So there's a pleasure center in the brain, and this is a very, very difficult thing to overcome. You eat these foods, you're going to want to eat more. Pure and simple. If you stop eating them, then you won't.
Now, you contend that we all have some type of food addiction and may
Yes.
not know it, or if somehow we've come upon the fact that we do have a food addiction, we just don't admit it and keep on eating.
Right.
That's the same as any other drug addict, right?
Absolutely. Look, bottom line is, in the United States, 70% of the population is overweight. Okay? 70%. We have 70% is overweight. 100 million people in the United States either have diabetes or pre-diabetes. Okay? It is the greatest health crisis confronting America today and probably the world. By the year 2050, 50% of the American population will have diabetes. Diabetes is the number one cause of blindness, of non-traumatic amputations, of heart disease, of a whole host of things, so something has to be done. Something has to be done. Now, you can't do everything, but you can do some things. My belief is, and I've seen it happen in patients, is that if you have people give up things like bread and potatoes and a couple of other addictocarbs, you are going to see the diabetes literally cured. Now, at the age of 52, I was on insulin. I was on injectable exenatide. I was on Prandin. I was on a host of hypoglycemics. Nothing could control my blood sugar. I went on this diet. I am no longer on insulin. I am no longer on any injectable medication for the diabetes. I no longer take prostate medication. I no longer take heart medication. Pure and simple. I know that this works.
Since the age of 52, and how long have you been doing the...
14 years. I'm 66 years old.
Okay, so I was going to ask, why did you write the Addictocarb Diet? But you're a living testimony as to why you need to get the word out about this.
Well, I'll tell you why. I was 52 years old. I went to the endocrinologist. I had diabetes, type 2, but it was bad. And I didn't have borderline diabetes. My hemoglobin A1C was 9.7, which by anybody's definition is florid diabetes. Okay? It wasn't pre-diabetes. I had diabetes, okay? I could not get my blood sugar under control. I was seeing an endocrinologist, and finally the guy said, that's it, it's over now, you just have to take insulin, Now, 52 was an interesting age for me. My father died at 52, okay? I had 2 young children. I did not want to leave them. I needed to make up my mind to do something about it. And I was not going to just go on a diet just to gain it back again, because I'd already done that already. I already had 1 cardiac catheterization. I knew that I had heart disease. I needed to do something that would see the disease retreat. And now all those diseases have retreated. I'm 66 years old right now. I can tell you there's nothing that I can't do now that I could do when I was 25 years old.
Now, what type of reception have you received from other healthcare professionals when you present this Addictocarb Diet to them and say, hey, why don't you tell some of your patients who may be struggling with weight and or diabetes to check out this diet?
Well, I'm at Mount Sinai Hospital here in New York, And certainly the reception there amongst my colleagues has been very good. I mean, I've spoken to the cardiologist and I've spoken to, but, I mean, doctors, outside of that, I can't say that I've necessarily spoken to doctors. I can go by what I see, for instance, on the website, what I see, the response that I get on Facebook, the response that I get from patients. The other thing is that my medical practice has a very high percentage of doctors and doctors' families. So certainly they have received it quite well. Look, the book has been received well. People like the book. People go on the diet. People lose it. I had one patient that we went to a thing for my son's school. It was a fundraiser, and I sat next to a patient of mine who had a kid in the school also. And when she sat down, I almost fell over. And I said, "I can't believe what you look like." And she said to me, 9 months ago I was in to see you when you told me about your diet. She said, "I thought you were a little crazy." She says, "But now, since I've lost 48 pounds, I feel very differently." And that's the response that I get from people and doctors in general, which she was one, and that is that diet works. I have patients come in all the time. They have diabetes. They go on the diet. They come back a month later, diabetes is gone. Now, obviously, the underlying disease is not gone, but you can treat it so you can bring the hemoglobin A1C back down into the normal range. And I've seen people come with a hemoglobin A1C of 7 or 8. And come back to a normal range. My hemoglobin A1C was 9.7. My hemoglobin A1C, my last one, was 5.9.
Now let's talk a bit about childhood obesity.
Oh, I know.
Does your Addictocarb diet address the kids as well?
Absolutely, absolutely. This is the most painful for me. When I went into medical practice, with whatever it was, 35, I hate to think about how many years ago it was, but a very long time ago, when I went into medical practice, there was type 1 diabetes and type 2 diabetes, and that was it, okay? There just wasn't anything else, okay? And type 1 diabetes, you got it when you were young or very young, and type 2 diabetes, you got it when you were old, relatively old, okay? That has totally blurred now. I have kids who are 16, 17, 18 years old who have type 2 diabetes. I have 25, 30-year-old people who have type 2 diabetes, people in their 30s with type 2 diabetes. Now the sequelae from getting type 2 diabetes are the same no matter when you get it. There are going to be amputations. You are going to go blind. There are things you are going to have to pay the price. You are going to have heart disease. You're going to have heart attacks, okay? You never used to see it. I'm seeing all these kids now that have type 2 diabetes. And what's the reason? The reason is because they're overweight. And the reason that they're overweight is because they eat addictocarbs. If they start cutting out addictocarbs, then they don't get it. Now, I start young. I'm a family practitioner. So I see newborns, and my oldest patient is 106. So I run the gamut. Because that's what I see. I start early, and I explain to parents to keep the bread and the potatoes away from the kids. Now, there are alternatives that you can turn to. You can have sweet potatoes. You can't have regular potatoes. You can eat all the sweet potatoes you want. You can take the kids to McDonald's if you want to take the kids to McDonald's. I don't know why you would want to, but if you would want to take the kids to McDonald's, fine. Burger King, fine. If you walk into Burger King and you ask them for the burger without the bun, they will say, "Oh, you mean the low-carb meal?" Huh. You say yes. They will serve you a Burger King hamburger served in a swath of lettuce. So it's just like a sandwich, and you can eat it just like you're eating a Burger King sandwich. Pure and simple. And there's no problem. And you're not going to get fat. Pure and simple. You're not going to get fat. You're not going to get diabetes. What kills you, there's a whole section of my book on fast food, because I'm not kidding myself. This is America. Fast food is everywhere. If you cannot stay on this diet and still work fast food into the diet, nobody's going to stick to it. Yes, you can eat a fast food. Yes, bunless and breadless. You don't need to eat the bun. You don't need to eat the bread. Yes, can you go to a Mexican place? Yes, you just don't eat the tortilla. You eat the stuff that's in the tortilla.
So we're talking all types of bread.
Yeah, yes, you cannot have bread. Bread's bad. Stimulates the addiction center. Eat bread, you're going to end up getting fat again.
With any addiction, sometimes you relapse.
Of course, no problem.
You have concessions for the person that says, "Hey, I've been doing this diet. It's great, but I had a slip." Are they back in full-blown carb addiction, or can they, get back on the wagon? Yes,
perfect question. The bottom line is this. Everybody is going to fall off the wagon. There is no such thing as an addict that doesn't fall off the wagon. I mean, I've been practicing medicine for 35 years. Everybody falls off the wagon. The point is that when you fall off the wagon on this diet, you need to look at it through the lens of addiction. Okay? For instance, this whole thing with Weight Watchers is all over the news. This thing with Oprah, listen, Oprah, I love you, but really, bread? She goes on TV and says to everybody, bread is great, and I eat bread every day, and I've lost 26 pounds. Well, if there isn't one perfect example of an addict, it's Oprah. She's gained weight, she's lost weight, she's gained weight, she's lost weight, she's gained weight, she's lost weight. That's not healthy. It's just pure and simple. It's not healthy. So if you fall off the diet, I have ways of dealing with it in the book. Of course you're going to fall off the diet. I got to go out with my brother-in-law this weekend. We're going out for a really fancy dinner. You got to have the 9-layer chocolate cake. Fine, have it. But understand what to do before you go out, when you come back, and the next morning. Before you go out, you have a shake, okay, or a bowl of fruit, okay, for instance, okay. You go out, you eat whatever you have to, but you do not have bread and potatoes. Not that hard. You can go out to eat a very fancy dinner. You do not have to have bread and potatoes, okay? And then when you get home, even though you've just eaten, you have another shake, okay? You get up in the morning, you have a shake again. The point is to look at it through the lens of addiction so you understand that you've fallen off the wagon. What do you do if you're an alcoholic and you have a drink? Let's say you go out, you're like, well, first thing you do is you don't get up the next morning and say, well, I think I'll just have another drink. No, you understand that you fell off the wagon. Okay, you're going to get back on the wagon. And go to a meeting, or in this case, you don't have to go to a meeting. You can have a shake, okay? Talk to people about it, but you realize the next morning, okay, I fell off the wagon yesterday, but that's it. Now I'm getting back on the wagon. Same thing is true with this diet. It's not that big a deal to fall off the wagon. The important thing is to get back on again. And
I'm going to tell our listeners that your book is available wherever books are sold, and is it available at your website as well?
Well, at my website, if you want, it'll take you to Amazon and to Barnes and Noble. I mean, I don't personally sell it, but Amazon has it, and Barnes and Noble have it online. But yes, if you go to the website and you click on purchase the book, it will take you to Amazon or wherever. I don't know all the different places, but they all have it.
Great. You've been listening to Health Professional Radio. I'm your host, Neal Howard. It's been a pleasure talking this afternoon in studio with Dr. Bruce Roseman. He's been in practice in Manhattan for 30 years or more and is affiliated with Mount Sinai Hospital, where he holds joint appointments in the departments of family medicine and OBGYN. He's also the author of the Addictocarb Diet, which is based on the latest in neuroscience research as it applies to appetite. It contends that weight gain isn't related to portion control, nor is weight loss. It's been great having you here with us today.
Thank you.
Thank you. Transcripts and audio of this program are available at hpr.fm, and you can subscribe to our podcast on iTunes.